What is the rotator cuff it's kind of like the golden question. I think people come in all the time and everybody's heard of it. No one really knows exactly what it does when they come in. The rotator cuff is a series of 4 muscles that have tendons that come together kind of almost as one confluent tendon, and it wraps around the top of the ball and socket joint of the shoulder. The goal of the rotator cuff is to keep the ball and socket joint of the shoulder, to keep the ball centered on the socket. As you go to raise your arm up in the air, your deltoid, a large muscle on the outside of your shoulder, contracts and goes to pull your arm up. And if you look at someone try to raise their arm and they have a large rotator cuff there, that's what they're doing. They can't really get their arm up. Once you develop irritation or inflammation within that rotator cuff, that throws the balance of the way the ball is supposed to be centered, and that winds up leading to pain and eventually dysfunction. If someone has a torn rotator cuff, it does not necessarily mean that they are doomed to surgery. It's the people who have a torn rotator cuff that's symptomatic, that's causing pain, that's causing weakness, that doesn't respond to non-operative management, or people who generally, if someone has a large acute tear where they fell, landed on their shoulder, now they have this big tear and they can't lift their arm, you're a little more inclined to go down the road of fixing that kind of right up front. The goal is to return their function back to normal and to eliminate their pain, and frequently we're able to do that. A number of factors go into that, but the goal is to take that tendon, the torn tendon, get it back to where it was supposed to be. Then the next step becomes getting your range of motion back. Generally, you're held in a sling for about 6 weeks after the surgery in order to give the tendon adequate time to begin healing. You're doing physical therapy during that time to maintain some of your range of motion, but inevitably, once you come out of the sling, there's a fair amount of stiffness. By about 3 months, most people are doing pretty well, getting their arm up. A lot of their pain is gone, but there's not totally back to normal. Then we begin the strengthening process, and usually at 4 months to 5 months, that person's back to normal.